At the Henrietta Johnson Medical Center in South Wilmington, a grant for $4.7 million was presented to DHIN, the Delaware Health Information Network, to help assist doctors provide better care.
This comes to us as a part of a federal initiative to build capacity to enable widespread, meaningful use of health information technology here in the first state.
Delaware became first in the nation to develop a statewide electronic health information system. DHIN will use the stimulus money to facilitate claims processing and eligibility verification for Medicaid and private payers. It will also allow doctors to electronically order procedures and therapies. Dr. Charles Case at the Henrietta Medical Center says the electronic system has definitely improved his medical practice.
We are fortunate, the federally qualified health centers are fortunate. We are thankful to the federal government, not only for the DHIN, but also the electronic medical records. It has made things tremendously better than it was before. And if you were to survey the staff here at Henrietta Johnson, they would tell you, we don't want to go back to the paper charts. We don't want to go back there. It makes our jobs that much easier. How? Well, my patient's in the emergency room. The hospitalist is coming down and saying, I need the medication list. With a paper chart, get the paper chart. Somebody's got to bring it to you. If you're lucky, 15 minutes goes by and you get it. And meanwhile, the doctor's in the emergency room. Where's the information about the medicine? Now with the electronic medical records, I need the medication list. I don't leave the room. Pull up the patient chart. It's all right there.
The Delaware Network will enable hospitals, lab facilities, and medical practices to transfer patient records regardless of differences in the provider's computer systems.
The concept is very straightforward. Everybody wants to be connected to everybody else. Nobody wants to manage multiple interfaces. The DHIN solves that problem by allowing everybody to connect with one interface, and then everyone can exchange information.
The network's recent grant was part of $750 million in federal stimulus grants for health information technology.
This is about jobs. This is about getting people back to work. And that's what the Recovery Act is about. So I just want to tell you, this is great. Now, the other thing that's in the Recovery Act is exactly what we're having here. This isn't just, to put people back to jobs. This is what are we going to do when we get to the end of this thing? You look back in the last 10 years, where did our growth come from? Housing, right? Consumer products, and finance. That's not what's going to lead us back out again. It's going to be the use of technology. It's going to lead us. We've got to be world class in terms of developing technology. There's plenty of things in the stimulus bill to lead us out of that. Today, it's going to help us come out of the healthcare crisis.